This is the Sunday Business Page with John Delano.
Hi, I'm John Delano. Welcome to another home edition of the Sunday Business Page. Our special guest is Dr. Amesh Adlaja, who is with the Center for Health Security at Johns Hopkins University. And more importantly, he grew up right here in Pittsburgh. Doctor, good to have you with us. Thank you, sir.
Thanks for having me.
So your expertise is in infectious diseases, and we've had you on the show a number of times over the years. As we all in Western Pennsylvania, including Beaver County coming up this Friday, move to this yellow zone, are you concerned? Are you worried that this could actually lead to more cases of COVID-19?
It's important to remember that this virus didn't go anywhere, that this virus hasn't changed its biological characteristics, and it's going to be something that we contend with for some period of time. So we have to expect that cases are going to go up as we increase social interaction. The key thing to remember, though, is that we want to make sure that the new cases that are occurring at a rate that's manageable by our hospitals and by our health departments for contact tracing. That's where we got into trouble before. Flattening the curve is about spreading out the number of cases, not necessarily decreasing the number of cases, but spreading them over time so our hospitals can cope with them.
So what you're saying, Amesh, is that inevitably more of us are going to get COVID-19, but hopefully at a level that the hospitals and the physicians can deal with this?
Exactly. That's what flattening the curve does. It keeps you below hospital capacity. We saw, for example, in New York City, that hospitals were under enormous stress where they were worried about shortages of personal protective equipment, mechanical ventilators, ICU beds. That's a situation we didn't experience here in southwestern Pennsylvania, and it's going to be something that we're going to have to keep an eye on as we start to peel back social distancing regulations, looking at our hospitals and saying, are they in trouble? Are they able to handle what's coming in? And if that's okay, that's kind of a signal that you can continue to remove social distancing. But if we get into trouble, then you have to start thinking about what can you do to decrease the transmission.
I want to ask you about that in a second, but do you expect a spike in cases here in southwestern Pennsylvania?
I do expect that there'll be an increased number of cases as people start interacting and giving the virus an opportunity to go from one person or another. I don't necessarily know if it's going to be a spike or what shape that number of cases is going to take, but we do have to expect there will be increased intensity of transmission as people get back to their lives.
So then let me ask you, doctor, if you're like me or my wife and you don't want to get COVID-19, period, how do you prevent that from happening and still maybe relax the way we live these days?
If you're part of a vulnerable population, if you're older, have other medical problems, you're going to still need to be very wary about your social interactions and trying to limit your exposure to this virus. It's going to be hard as people are going back to work and people are interacting, but that's something that we're going to have vulnerable populations doing for some period of time, especially if you think about nursing homes, for example. Those are going to be basically on lockdown until there is a vaccine. So this is something that you have to kind of incorporate into your own life and what risks you're willing to take, what your risk tolerance is, and what your individual risk profile is. There are things you can do in terms of trying to stay 6 feet apart from people, washing your hands a lot, refraining from touching your face, trying to avoid crowded places, going to places off peak hours. There are things you can do to try and reduce the harm that you might suffer from being in an environment where the virus is there, but it's not going to be something that's ironclad, and no activity is going to be without risk.
So bottom line, who should stay at home regardless of whatever the government says?
If you are somebody that's older, if you're somebody that has other medical problems, or if you take care of people that fall into that group, you may want to still limit your activities and your exposure to other individuals for the foreseeable future until we have a vaccine, because this is something that is going to be out there and we're going to have to deal with. So it's going to be very difficult, and it's not going to be a one-size-fits-all type of recommendation for people. You really have to look at your own life and what's essential to you, what's not essential to you, and what risk you're willing to take.
Well, Dr. Amesh Adlaja, thank you, sir, very much for being with us today. We really appreciate it. And thank you for watching us on the Sunday Business Page. If you have a suggestion for a guest, get in touch with me at jdelano@kdka.com. Have a great Sunday, everybody.